there is darker pigmentation noted on my exam on the scrotum, which is a normal finding. The left testicle appears slightly larger than the right, so it is not symmetrical, but on an exam of the scrotum, that is a normal finding. On palpation, the texture is rough. There's no abnormal thickening. There's no hernia noted. So next you will transilluminate the scrotum. You'll use a pen light and put it against the scrotum. You perform this normally if you felt any masses on palpation of the scrotum, which I did not, but you'll be looking, just placing the light against the scrotum, and you'll be looking to see if you can visualize any masses. Can you see through the masses? That type of thing. There are no masses noted on transillumination during my exam. So next, I'm going to palpate the inguinal canal for a direct or indirect hernia. So I'll ask the patient to stand up and strain, and I'm going to inspect the inguinal area and region of the fossa ovalis. I'm going to have the patient relax and insert the finger into the lower part of the scrotum and carry upward along the vas deferens into the inguinal canal. No direct or indirect hernia should be palpated, and none is palpated on my exam. So next I'm going to palpate the testes, the epidermis, and the vas deferens for consistency, size, tenderness, bleeding. You're going to palpate it by using the thumb and first two fingers. There's mild tenderness noted on exam, which is a normal finding. It feels smooth. There's no nodules or irregularities. The epididymis is located on the posterior lateral surface of the testes. They're smooth and non-tender. The vas deferens is smooth and discrete with no lumps or abnormalities. So next I'll move on to my assessment of the anus, rectum, and prostate, and I'll explain the procedure to the patient. First I'm going to inspect the sacrococcygeal and perianal area. I'm just going to be noting that this area, the skin is smooth. The pigment is congruent with the rest of the skin. There's no lesions, no tuft of the hair, there's no inflammation, there's no excoriation. So next I'm going to inspect the anus by spreading the buttocks apart and using a light. The pigmentation is darker, rough skin texture. There's no fissures, no hemorrhoids, no polyps, no fistulas, and there's no prolapse noted on my exam. So in order to assess the sphincter tone, I'm going to lubricate a gloved finger and place it in the anal opening. I'm going to have the patient bear down, and once the patient feels relaxed, I'm going to slip the finger in further and ask the patient to tighten the sphincter. On my exam, there's normal sphincter tone noted. The tone is even around. It's a tight tone, which is normal, and it could also be fear or embarrassment during exam. So I'm going to palpate the lateral, posterior, and anterior rectal walls. I'm just going to be noting that there's no nodules, masses, polyps, tenderness, or irregularities noted. And then on the male, I'm going to palpate the posterior surface of the prostate gland through the anterior rectal wall. On exam, I'm going to be noting that it is within normal limits. It is firm, smooth, and slightly movable. It feels approximately 4 centimeters in size, which is a normal finding in an adult male. Moving on, I'm going to have the patient bear down and palpate deeper for tenderness or nodules. There's no tenderness or nodules noted on my exam. So on withdrawal of the fingers, I'm going to note again the stool or blood. I'm going to be taking note of the stool color, consistency, again, if there's any bright red blood, if there's any dark discoloration, or anything, just examining for any type of bleed. And that's all. Thank you.